You're listening to Medicare Tales and Marshmallows, the only podcast where we pair prescription talk with puffy snacks and try not to burn either. I'm your host, Kim the Curious, and today we're digging deep into another alphabet soup that is the drug plan, popularly known as Medicare Part D. Also known as the reason your pharmacist looks exhausted by mid-January. Backed by popular demand and possibly by divine appointment is Dr. Constance Aldridge, former Medicare official and walking encyclopedia of weird coverage codes. Dr. Connie, welcome back.
Happy to be here. I brought a bottle of water, 3 different Tier 3 medications, and a flow chart labeled, "Why is this so complicated?"
I know, right? Okay, let's cut straight to the chase. What is Medicare Part D?
Medicare Part D is prescription drug coverage offered through private insurance companies approved by Medicare. You can get it 2 ways: as a standalone Part D plan, if you're on original Medicare, or as part of a Medicare Advantage plan that includes drug coverage.
And this is all optional? So, for example, if I don't use any prescription drugs, I don't need a plan, right?
Technically, yes. But skip it without other creditable coverage, you'll pay a lifetime penalty for every month you delayed.
Ouch, that has to hurt.
Yep, hurts enough to need a prescription for sure. Each plan also comes with tiers.
Ah, yes, tiers. Please explain before I run screaming into the forest.
Most plans have a formulary, a list of covered drugs, divided into tiers. Tier 1, preferred generics, cheap and cheerful. Tier 2, non-preferred generics, still cheap-ish. Tier 3, preferred brand name drugs. Tier 4, non-preferred brands. Tier 5, specialty meds, aka costs that much meds. Seriously though, no need to memorize all of this. The main thing to remember is, higher the tier, the more you pay. Plans also have pharmacy networks, prior authorizations, and quantity limits. So it's a game of, will this be covered? And will I need to call my doctor again?
Oh my, sounds like a scavenger hunt at your local pharmacy.
With a battle at the register.
Touché, Dr. Connie, touché. Now let's talk about the famous or infamous donut hole.
The dreaded prescription coverage gap. Thankfully, that no longer exists, so we can skip it. But when it did, it was like climbing a hill made of co-pays and deductibles, falling into a donut hole, then emerging into a utopia of free meds. Though the utopias came with mail-order refills and prior auth faxes. The good old days.
Good to know some things do get fixed. Phew. So, what are some common mistakes people still make with Part D?
Let me count the ways. Not checking the formulary before signing up with a plan. Your drug might not be covered at all. Ignoring the pharmacy network. Costs vary wildly between in-network and out-of-network pharmacies. Assuming one plan fits all, the cheapest premium isn't always the cheapest total cost. Skipping annual reviews. Plans change their formularies every year. A drug covered in one year might jump tiers or disappear the next.
So it's like speed dating. You need to reevaluate every year or risk waking up next to a hefty copay.
Beautifully said.
How can folks get help navigating all this?
The good news is there are many support options, and they're all free. In no particular order, I advise folks to use Medicare.gov's Plan Finder tool, call your state health insurance assistance program, SHIP, for free, unbiased help, and for low-income individuals, definitely see if you qualify for your state's Extra Help Low-Income Subsidies Program, LIS.
Right.
Talk to a licensed agent, preferably an independent one that covers many options, not just one company. Last but not least, explore additional cost assistance options. And yes, this may take a bit of research. Resources include GoodRx, Needy Meds, NiceRx, Medicine Assistance Tool, which provides a search engine, Partnership for Prescription Assistance, and last but not least, many don't know this, but most major drug companies also have their own patient assistance programs, PAPs. Now, some of these will be based on income, but I always tell patients it never hurts to apply for assistance and see if you qualify.
All great pointers. Parting thoughts, Doc?
Seriously, ultimately, Part D isn't the devil, it's just deeply misunderstood. With a little homework and a dash of caffeine, it can work for you. Just maybe keep a spreadsheet.
Or at least a well-labeled shoebox. That's it for Part D, the plan with more tiers than a Victorian wedding cake. Thanks to Dr. Connie for walking us through the maze without breaking a sweat. Until next time, keep your meds sorted, your tiers labeled correctly, and your marshmallows toasted.